Dynamic assessment involves a process in which cueing is provided to facilitate performance, and that helps us see skills that might still be emerging. And it contrasts with static assessment, which is more typical of standardized tests, where the child's skills are measured after a single response with no assistance from the examiner. So I might say it, they respond right or wrong, versus where we really help the child and see what they can do. So there are several advantages of using dynamic assessment. The first advantage is that it allows observations of what the child does when he or she attempts movement gestures for words or specific syllable shapes versus what he does habitually in spontaneous speech. Now remember, without cueing, the child may not increase their attention or effort toward saying a particular word, but even with minimal cueing like watch me or a gestural cue, letting them know it's okay if they do it wrong. If they do, we'll help them. It's common in our experience for the child to more actively at least try to attempt the correct movement gesture. And when we do this, the child is more likely to exhibit some of these characteristics that we associate with the label CAS. The second big advantage in the case of differentiating children with CAS is that we have the opportunity to evaluate all the characteristics associated with the label, but also the degree to the frequency with which they exhibit them and how much time it takes for them to improve with our cueing. Some of the things that we may see are groping, that's not evident in spontaneous speech, but does occur when the child is trying to imitate specific words or phrases. Inconsistency across trials as cueing occurs. Segmentation of syllables, which occurs only when the child's attempting correct articulatory movement gestures or when the child's attempting to produce a bisyllabic or multisyllabic word. The third big advantage in using dynamic assessment is that it has the potential to facilitate judgments of severity and therefore prognosis. If a child consistently needs considerable cueing to correct or correctly produce a target or never produces it at all despite all our cueing, then we see his problem as being more severe. On the other hand, if the child improves accuracy of movement with only a few cues, we know that he or she will make quick progress, and it indicates less severity and makes the prognosis better. When using a static assessment strategy, we can't as easily make judgments of severity or prognosis.